Most nurses have heard of chronic care management, but many nurses still do not know there's another Medicare supported service called Principal Care Management, also known as PCM. And this is important because PCM focuses on patients with one chronic condition that requires ongoing management, education, coordination, and support. In this video, I want to break down what principal care management is, how it differs from chronic care management, why it matters in healthcare today, and how nurses fit into all of it. If you're new here, my name is Natasha. I'm a registered nurse and care management consultant, and I help nurses and healthcare organizations better understand the role of nurses in care management and value based care. One thing I want nurses to understand is that healthcare is moving towards more coordinated, outcome focused care models, and nurses are central to that transformation. So let's start simple. Principal Care Management, or PCM, is a Medicare service focused on patients living with one serious chronic condition expected to last at least 3 months. Unlike chronic care management, which focuses on patients with two or more chronic conditions, PCM focuses on one complex condition that places that patient at significant risk of hospitalization, exacerbation, functional decline, or death. These may include conditions like advanced heart failure, COPD, cancer, chronic kidney disease, severe diabetes complications, neurologic disorders. PCM is often associated with specialty care because these patients usually require more focused disease specific management. The goal is to help improve outcomes, reduce complications, support care coordination, and provide ongoing management between visits. PCM may include medication management, patient education, coordination between providers, symptom monitoring, reviewing treatment plans, helping patients navigate complex care needs, and ongoing communication and follow up. Now, to really understand PCM, you have to understand the healthcare problem it was designed to address. Patients with serious chronic illnesses often require much more support than short office visits can provide. These patients may experience frequent exacerbations, require specialist management, struggle with treatment adherence, become overwhelmed managing symptoms, have repeated hospitalizations, or experience declining quality of life over time. CMS, the Centers for Medicare and Medicaid, recognize that these higher risk patients need more focused support and ongoing management outside traditional office visits. Because when patients are not properly supported, complications increase, hospitalizations and emergency room visits increase, disease progression worsens, and healthcare costs rise. Nurses understand this better than most because we see what happens when patients do not have enough support managing chronic illness. Specialty practices are busy. Providers are managing complex patients, documentation, treatment planning, staffing shortages, administrative burden, quality reporting, and high patient volumes. These patients with serious chronic conditions often require frequent communication, monitoring, education, and coordination. That takes time, developing workflows, building systems, and it takes consistent patient engagement. That is exactly where nurses bring tremendous value. Nurses are positioned to support principal care management services because we already understand how chronic illness impacts patients physically, emotionally, and socially. We educate patients, reinforce treatment plans, identify worsening symptoms, coordinate care, and communicate with providers and families. We also help patients understand medications and disease processes while helping them navigate the healthcare system. And many patients living with serious chronic illness simply need someone consistently helping them manage the complexity of their condition. That support matters. And this creates opportunities for nurses interested in care management, specialty care coordination, consulting, value based care, patient education, and chronic disease support. Because healthcare organizations need nurses who understand both patient care and care coordination. And PCM is part of a much bigger shift happening in healthcare. Healthcare is moving towards more preventive care than reactive care coordination, reducing avoidable hospitalizations, improving patient outcomes, and value based care. Programs like PCM recognize that patients with serious chronic illness need ongoing support between visits because healthcare is not just about treating disease. It is also about helping patients manage life with chronic illness, and nurses are essential to that work. If you're a nurse and you're interested in learning more about care management and how nurses can position themselves in these growing healthcare models, I review this inside my mentorship. I'll show you how these services work, how nurses fit into them, and how to position yourself in this growing area of healthcare. You can check that out in the description below. And if this video was helpful, make sure you subscribe because I'll be breaking down more care management and value based care topics for nurses.